Hey, this is Jeremy, and today we're going to be talking about end-of-life decisions. Now, end-of-life decisions is something that we need to be intimately familiar with, especially in our older population or our population that has special challenges such as they're ventilator dependent or they have a degenerative disease that is terminal. And, that person they have a right to decide how their medical decisions are going to play out at their end of life circumstances. Their end of life medical care is something that they should have a right to decide, have a deciding factor in. And so that's where these end of life decisions come in. And whenever we refer to patient autonomy, that's going to refer to the right of a patient to decide how they want their end-of-life medical care actually provided to them. And so this can lead to something that's on their advanced directives that says do not intubate, or do not perform compressions, or you can provide me pain management and oxygen therapy, but nothing else. And it's just a way for them to be involved in their medical care after they've lost the ability to make those decisions for themselves. And so we have advanced directives. Advanced directives, that is a written document that expressly expresses the wants, the needs, and the desires of the patient for their future medical care, should they not be able to consent for it verbally, or maybe they've lost their ability to think rationally due to a disease process of some sort. Living wills, DNRs, organ donation orders, all those are examples of an advanced directive. It's something that somebody has set up in advance of an illness or in advance of a situation. And whenever that situation comes up, this is the care that they want provided for them. This is what they want done with their body, and this is what they want done with their organs, especially in the circumstances of organ donors. And again, they may dictate what they want to have or what they do not want to have, such as a do not intubate order. That's going to allow you to be able to perform compressions. That's going to allow you to be able to perform a BVM mask, and it's going to allow you to provide IV therapy and electrical therapy. But you are not going to be able to intubate that patient because that is their medical wishes. Now, we also have two types of durable powers of attorney. So it's a living will is a durable power of attorney, and a healthcare power of attorney is a durable power of attorney. So the reason that the word durable is thrown into them is because they remain in effect even after a patient has lost their decision-making capacity, such as somebody who has end-of-life disease such as Alzheimer's, dementia, or maybe they have brain cancer or Huntington's disease or anything like that. A living will is typically it's going to be a document, and it's typically going to have some type of precondition that's going to require it to be activated, such as a terminal illness or an irreversible coma. And it's going to spell out exactly what kind of wishes that patient should be given, or what kind of treatments and what that patient wishes for themselves should they become incapacitated, and again they lose their decision-making capacity. Now, healthcare power of attorney is another one. Healthcare power of attorney is that's the surrogate decision maker for that patient whenever they lose their decision-making capacity. And that last part is important. Whenever they lose their decision-making capacity, just because I were to make somebody my healthcare power of attorney does not give them the right to dictate everything that goes on in my life, as should I be alert and oriented and have a decision-making capacity of my own. And you may see this in somebody who does have a terminal illness, and they've provided their daughter or their child or grandchild as their healthcare power of attorney, and their daughter, their son, whoever wants them to be transported or doesn't want them to be transported. But the patient that is, that healthcare power of attorney is for wants to be transported. If the patient wants to be transported and their power of attorney says no, you operate off of the patient's wishes because they have that decision-making capacity. They have the right to still consent to their end-of-life care. And if you have a patient that does not wish to go, and they're sick, and you can clearly tell that they're sick, but the patient's power of attorney, healthcare power of attorney, decides that I want them to go. Until that patient goes unconscious, unresponsive, and they've lost their ability to make those decisions because they've become incapacitated, you cannot kidnap that person, regardless of whoever it is they have as their healthcare power of attorney. Okay, and you should never refuse care to a patient who desires it, even if they are on hospice. There are certain situations where if you have a hospice patient that falls, well, they're not on hospice for that fall. They're on hospice for their lung cancer. Just because they fall and they call 911 does not mean that since they're on hospice, you are not allowed to transport them. You're not breaking a hospice agreement. You're not breaking anything because you are transporting them and you're treating them for a disease or for a condition that is not the one that they're on hospice for. And that is an important thing to understand. Never withhold treatment from somebody who desires it. And now we're getting into DNRs. A DNR is a do not resuscitate order. That's going to be that they can differ from state to state, but they generally have a couple requirements that they have to have to be valid. It's going to have to clearly label label your patient with their name, date of birth, and have that information on there. It's also going to have to clearly label your patient's medical conditions. What is it that they have this DNR order for? Or do they just have one to have? It's going to have the signature of that patient or that patient's legal guardian, especially if it's a minor, an incapacitated adult, or somebody who's elderly. Maybe their legal guardian is their wife, or maybe it's their child. And there is a difference between the healthcare power of attorney and a legal guardian. And it's also going to require the signature of one or more physicians. If it is missing, if it's missing any of this information, if it's missing laying out the patient's medical conditions, if it's missing the signature of the patient and legal guardian, and if it's missing a signature of at least one physician, then it cannot be considered valid. And in some states, this does differ from state to state, there is an expiration date on them. And if you operate within a state that does require an expiration date on DNRs, then you need to make sure that it is dated on there, and it must be dated within the previous 12 months. And that is an important thing to look for whenever they provide you with a do not resuscitate order. Now, if the situation is ever questionable, or you have somebody who is unable to provide documentation for what's going on, then you should always err on the side of caution. And if nothing else, you should always contact your medical control. And so, for example, if you start working, if you get called out for a difficulty breathing, and you get there and that patient is in cardiac arrest, and they have a do not resuscitate order, well, they need to provide you the do not resuscitate order. If they're unable to provide that, then you're under an obligation to perform CPR, as long as there's no obvious or definitive signs of death or anything like that dependent on your protocols and dependent on how your service operates, might change what it is that you have going on and the way that you handle that situation. But again, if ever a situation is questionable, or you have a question about a document, or you have just a question about how to handle a situation, you should always contact your medical control, whether it be your medical director, a physician at the hospital that you're going to transport to. But you should always consult somebody if you are unable to answer something yourself. And so those are the real big things about the end of life care.